In this session, we're going to untangle 4 differential reinforcement procedures that show up all the time on the BCBA exam: DRA, DRI, DRO, and DRL. Think of them like 4 different dials you can turn on reinforcement. DRA replaces the problem behavior with a better one. DRI blocks it with an opposite behavior. DRO stops it by reinforcing 0 occurrences, and DRL slows it down to a more acceptable rate. As we go through exam-style scenarios, focus on exactly what is being reinforced and under what condition. That's the key to picking the right label. Let's quickly map the 4 procedures in everyday language. DRA is differential reinforcement of alternative behavior. You still allow the same function, like escape or attention, but you require a more appropriate alternative response. DRI is incompatible behavior. We reinforce something that physically cannot happen at the same time as the problem, like hands in pockets instead of hitting. DRO is other behavior. We don't care what the person is doing, we just reinforce that the target behavior did not occur during a time window. DRL is low rates. The same behavior is okay, but only if it happens less often than before. Remember this summary: DRA replaces, DRI blocks, DRO stops, DRL slows. We have a student who throws materials to escape difficult tasks. The BCBA introduces a help card so the student can request a break, and now the teacher reinforces the use of that card. On exam questions like this, notice the flow: problem behavior equals throwing, new behavior equals using the card, consequence equals getting a break. Clearly, the new behavior is designed to give the student the same outcome: escape from work, but in a socially acceptable way. As you read the options, ask yourself, which procedure describes reinforcing a new, appropriate response that gets the same function as the old behavior? When you see a question like this, your first diagnostic question is reinforcement being delivered for a new behavior that serves the same function as the problem behavior? If the answer is yes, you should immediately think of DRA. With DRA, we are not just asking for anything else or for a physically opposite behavior. We are teaching a specific replacement that still lets the learner achieve what they wanted in the first place, like getting a break, getting attention, or getting a tangible. That's what's happening with the help card. The function is escape, but the form of the behavior has been upgraded. The correct answer is B, DRA. The problem behavior, throwing materials, was previously reinforced with escape. We've taught a new behavior, presenting the help card, that still produces escape, but in an appropriate way. That's textbook DRA. Option A, DRO, would mean we reinforce anytime throwing doesn't happen, without caring what the student is doing instead. Option C, DRI, would require a behavior that physically can't occur while throwing, like hands folded on the desk, which isn't specified here. Option D, DRL, is about allowing throwing in smaller amounts, not about teaching a new response. So the big takeaway: when the new behavior is functionally equivalent, think DRA. In this scenario, the child keeps standing up and walking around during lessons. The teacher decides to reinforce the child for sitting in the chair. Visualize this. At any single moment, the student is either in the chair or up walking. They literally cannot do both at once. That's the clue the exam is giving you. We are not focusing on the function here. We don't know whether the wandering is for escape, attention, or automatic. Instead, we are picking a behavior that makes the problem impossible. When the reinforced behavior physically blocks the target behavior, you're in DRI territory. For questions like this, ask yourself one simple question: can both behaviors happen at the same time? If the answer is no, then DRI is your best answer. In our case, you cannot simultaneously sit in a chair and walk around the room. Reinforcing sitting automatically reduces walking. If the behaviors could happen together, but you're choosing one as a better option that still serves the same function, that's more like DRA. So for DRI, your brain should say, opposite, mutually exclusive, they can't co-occur. The correct answer is B, DRI, differential reinforcement of incompatible behavior. We deliver reinforcement when the student is sitting, which physically prevents walking around. Option A, DRA, is a broader idea, reinforcing an alternative behavior, but the test is asking you to choose the most precise label. Options C and D don't fit. DRO would reinforce any period with no standing or walking, regardless of what the child is doing. DRL would care about the rate of walking, not whether it can happen at all while sitting. So remember, when one behavior literally blocks the other, pick DRI. Here the BCBA sets a 5-minute timer. If the client does not shout at all during those 5 minutes, they earn a token. Notice what is being reinforced. It's not a specific replacement behavior. There's no mention of asking nicely or using a communication card, and it's not a physically opposite behavior. The only condition is no shouting happens in that time window. On exam questions, as soon as you see if no X occurs during this interval, then reinforcement is delivered, you should immediately think of DRO. To spot DRO, ask yourself, is reinforcement contingent on the absence of the target behavior for some amount of time? If yes, that's differential reinforcement of other behavior. You'll often see timers, intervals, and phrases like if there is no hitting, if no screaming occurs, or if he goes 10 minutes without. Another important detail, with DRO, we don't require a particular alternative. The learner could be doing lots of different appropriate things, and they still earn reinforcement as long as the problem behavior hasn't occurred. The correct answer here is A, DRO. The token is delivered only if there is zero shouting during the 5-minute interval. That matches the definition of DRO, reinforcing the omission of the target behavior. Option B, DRA, would require us to identify a specific alternative, like using an inside voice to ask for attention. Option C, DRI, would require a behavior that physically prevents shouting, such as sustained whispering or silent reading, which isn't mentioned. Option D, DRL, allows some shouting but at a lower rate. Here the goal is zero shouting during the interval, not just less. So, timers plus no behavior language equals DRO. This student raises their hand 20 times during a 30-minute class. So the problem isn't that the behavior is inappropriate, it's that it's happening way too often. The teacher decides to praise the student only if, on the next day, the hand raising is 10 times or fewer in that same time period. Pay attention to what changed. We're still reinforcing the same behavior, raising a hand, but only when it happens at a lower rate than before. That is the classic setup for DRL, differential reinforcement of low rates. To recognize DRL, look for phrases like less often, fewer times, no more than X times, or an explicit comparison between a baseline rate and a target rate. In DRL, the behavior itself is acceptable in moderation. We don't want to eliminate it entirely. The exam often uses examples like raising a hand, asking questions, or snack requests, things that are fine as long as they don't dominate the whole session. If the goal is moderation, not complete absence, and reinforcement is contingent on staying under a certain count, that points you to DRL. The correct answer is C, DRL. We're reinforcing the same response, hand raising, only when its frequency drops from 20 times to 10 or fewer within a 30-minute period. Option A, DRO, would require the student not to raise their hand at all, which we clearly don't want. Option B, DRA, would involve teaching a new alternative behavior, such as saving questions for the end on a note card. Option D, DRI, would call for a physically incompatible response, which this question doesn't describe. So anytime the exam is telling you, same behavior, but fewer times, think DRL. The BCBA wants to reduce kicking. There are two different things being reinforced. First, the client earns tokens for keeping both feet flat on the floor. Second, they receive praise every 10 minutes in which there has been no kicking. So we need to label each piece. Feet flat on the floor is a behavior that physically cannot co-occur with kicking. It's the opposite posture. No kicking for 10 minutes is an absence of behavior requirement tied to a time interval. Once you see those two ideas, opposite behavior and zero occurrences in a time window, you should be thinking DRI plus DRO. When an intervention includes more than one contingency, take them one at a time. Ask, is any behavior being reinforced because it's physically incompatible with the problem? If yes, label that as DRI. In our example, feet flat on the floor makes kicking impossible. Next ask, is reinforcement also being delivered for no kicking during a specified interval? If yes, that's DRO. Once you've identified each component, scan the answer options for the pair that lists both terms. The exam loves to test whether you can see combinations like DRI plus DRO or DRA plus DRL inside one plan. The correct answer is B, DRI plus DRO. The DRI part is reinforcing feet flat on the floor, which directly blocks kicking. The DRO part is praising every 10 minutes in which no kicking occurs, regardless of what else the client is doing appropriately. Option A, DRA plus DRO, would be wrong because we don't have a functionally equivalent alternative, just an incompatible posture. Option C, DRA plus DRL, would require both a replacement and a reduced rate specification, which we don't have. Option D, DRI plus DRL, would imply we're only reinforcing lower rates of kicking, but here the praise is contingent on zero kicking in that interval. So we truly have DRI plus DRO working together. The BCBA is reinforcing a student for completing a worksheet instead of ripping the paper. This is a classic place where people confuse DRA and DRI. Ask yourself, can the student, in principle, complete parts of the worksheet and still rip it at some point? Yes. The two behaviors are not strictly mutually exclusive in the way that sitting versus standing is. The key here is that completing the work is being used as a more appropriate way to contact escape or task completion rather than ripping the paper. That makes it a functionally equivalent alternative, which points you toward DRA, not DRI. The question to ask is the reinforced behavior physically incompatible with the problem, or is it functionally equivalent? For DRA, we care most about function. The new behavior serves the same purpose, getting a break, finishing a task, gaining attention, but in a more acceptable way, like raising a hand instead of shouting. For DRI, we care about physical impossibility. One behavior blocks the other, like hands in pockets versus hitting. In our scenario, completing a worksheet is not physically opposite to ripping, but it does provide a valid path to finish the assignment and move on, which fulfills the same overall goal. The correct answer is B, DRA. Completing the worksheet is being reinforced as the appropriate replacement for ripping. The function is related to task completion and possibly escape from work once it's done, and we've given the learner a healthier way to meet that goal. Option A, DRI, would require a behavior like keeping hands folded or placing the pencil down, something that makes ripping impossible. Option C, DRO, would simply reinforce any interval in which no ripping occurs, with no requirement to complete work. Option D, DRL, would allow some ripping but at a lower rate, which clearly isn't the plan. So whenever the new behavior achieves the same outcome in a better form, label it DRA. A child calls the teacher's name 15 times during snack. The BCBA decides to praise the child only if they call out 5 times or fewer. So calling the teacher's name is still allowed, but we're placing a cap on it. We're not asking for zero calling out. We're asking for less calling out. That's a crucial difference from DRO. DRO would say, you get reinforcement only if there are no calls at all during this interval. Here we are reinforcing a lower rate of the same behavior, which is the hallmark of DRL. Whenever you are torn between DRO and DRL, ask, is reinforcement contingent on zero occurrences or on fewer occurrences? DRO equals 0, no bites, no hits, no calls. DRL equals fewer, no more than X times, or more than Y seconds between responses. In our example, the contingency is 5 times or fewer, which clearly fits DRL. Creating a mental mini-table can help. DRO equals absence, eliminate. DRL equals lower rate, moderate. Quickly running that check during the exam will save you from picking the wrong one. The correct answer is B, DRL. The BCBA is reinforcing the child when they keep calling out at or below a set limit, 5 times instead of 15. That's exactly what DRL is designed for. Behaviors that are acceptable in small doses, but disruptive when excessive. Option A, DRO, would require zero calling out, which is not what's described. Option C, DRA, would involve teaching a different way to get the teacher's attention, like raising a hand or waiting for a cue. Option D, DRI, would expect a behavior that physically prevents calling out, such as quietly writing, which the scenario doesn't mention. So remember, DRL equals reinforcement for moderation, not elimination. The student often talks to peers during independent work. The teacher now reinforces the student for writing quietly, and the description notes that this prevents talking. Think about what the hands and mouth are doing. When the student is focused on writing and staying quiet, they are not simultaneously chatting with peers. This is an example where the reinforced behavior directly interferes with the problem behavior. The two can't happen at the same time. The exam wants you to recognize that this is DRI, even though you might also argue it's helpful academically. The key diagnostic question again is, does the reinforced behavior physically block the target behavior? If writing quietly prevents peer talking, then we are reinforcing an incompatible response. The process is, first, clearly label the target behavior, off-task talking. Second, identify what is being reinforced, in this case, quiet writing. Third, ask whether both could happen together. If the answer is no, you're dealing with DRI. If they could co-occur but serve the same function, you'd lean toward DRA instead. The correct answer is B, DRI. Writing quietly and talking to peers are incompatible within this context. Reinforcing writing reduces the opportunity for talking. Option A, DRA, is too broad here. The new behavior isn't a functionally equivalent way of getting social interaction, it simply blocks it. Option C, DRO, would reinforce intervals with no talking regardless of what else is happening, which is not how this plan is structured. Option D, DRL, would allow some talking at a reduced rate. Instead, we're aiming for zero talking while writing. So for the exam, when one behavior naturally shuts down another, choose DRI. Here the therapist delivers a token every 30 seconds that the client does not scream. If screaming happens, the 30-second interval resets. So the client only earns a token when there has been a full 30-second block with no screaming at all from start to finish. That tells us two things. First, this is a DRO procedure because reinforcement is based on absence of behavior. Second, we need to decide what kind of DRO it is, whole interval or momentary, by looking at how the interval is evaluated. To distinguish whole interval DRO from momentary DRO, ask, do we require no behavior during the entire interval, or just at a single moment in time? Whole interval DRO means any occurrence of the behavior within the interval cancels reinforcement and often resets the timer. That's exactly what our scenario describes. Momentary DRO, on the other hand, only checks at the end of the interval. The behavior could have happened earlier, and the person could still get reinforced if they're not doing it at that final moment. When you see a reset each time the behavior occurs, think whole interval. The correct answer is A, whole interval DRO. Tokens are delivered only if the client goes the entire 30 seconds without screaming, and the interval resets if screaming occurs. That shows we're monitoring the whole interval, not just the end. Option B, momentary DRO, would not involve resetting. It would simply check whether the client is quiet at each 30-second mark. Option C, fixed interval DRO, is a confusing label the exam might throw in, but what matters is that this is an interval-based DRO with whole interval criteria. Option D, DRL, allows some screaming as long as it's less frequent, which contradicts the reset rule here. In this scenario, the child hits to get attention. The BCBA teaches them to tap the teacher's shoulder instead and then reinforces that tapping. When you see a plan where the new behavior produces the same outcome, in this case, adult attention, but in a more appropriate way, that should immediately trigger DRA in your mind. We're not just blocking hitting. We're giving the learner a new tool that still gets what they were seeking from the environment. To identify DRA, go through 3 steps. Step 1. Name the problem behavior and its function. In this case, hitting to gain attention. Step 2. Name the replacement behavior, tapping the teacher's shoulder. Step 3. Ask, does the replacement behavior achieve the same function in a socially acceptable way? If yes, you are looking at DRA. Notice that we don't require the behaviors to be physically incompatible. The focus is on meeting the same need using a better response. The correct answer is B, DRA. Tapping the teacher's shoulder is explicitly taught and reinforced as the new way to get attention, replacing hitting. That's a functionally equivalent alternative. Option A, DRI, would apply if the behavior we reinforced made hitting impossible, such as keeping hands in pockets, which isn't the case here. Option C, DRO, would mean we only reinforce time periods with no hitting without requiring tapping. Option D, DRL, would treat hitting as acceptable in small doses, which is not appropriate for aggression. So, again, whenever a new behavior is taught that gives the learner the same payoff in a safer or more appropriate way, that's DRA. We've just walked through 10 exam-style questions that force you to discriminate among DRA, DRI, DRO, and DRL in real scenarios. Remember our shorthand. DRA replaces the behavior with a functionally equivalent alternative. DRI blocks it with an opposite behavior. DRO stops it by reinforcing zero occurrences within a time window, and DRL slows it by reinforcing lower rates. When you practice, keep asking yourself, what exactly is being reinforced and under what condition? If you can answer that, you'll pick the right label on the BCBA exam and design cleaner treatment plans in real life.